Welcome back in at 9/11. February is American Heart Month. It's a time for people, especially women, to pay really close attention to their cardiovascular health. And the focus of this year's Heart Health Month is aimed at urging women to pay attention to their hearts and to advocate for their own health. And no one knows how important those lessons are than our next guest, who suffered 6 heart attacks by the time she was just 18 years old. We welcome into the studios now the 2023, the current Miss DC, District of Columbia. Good morning to you.
Good morning.
You look wonderful and flawless. And multiple heart attack survivor Jude Mabone into the studios, and also her cardiologist, Dr. Barbara Shrichai, the head of the MedStar Women's Heart Health Program, to talk about this very important issue. Welcome to our studios, both of you, and I love the color coordination for Heart Health Month, right? Jude, let me start with you. So first heart attack at 16. This is almost unimaginable to see you sitting here, the picture of health. At 16, you're jogging, you suffered the first heart attack, and then 5 more by the time you were 18. Can you just give a snapshot of what this health journey was like for you?
Right, so I had my first heart attack when I was 16. I was on a very standard 6-mile run. I was a competitive distance runner, and so that was pretty normal for me. It was summer cross-country practice, and I started having chest pains, more symptoms, sweating, nausea, like just profuse sweating, nausea, a headache. And so I went to the hospital, and they did a full cardiac workup, and they said, "You got a heart attack." And I said, "That's not possible. Like, I'm so young and healthy. Like, I'm not what people think of when we think about heart disease." It took about 1.5 years before we got a diagnosis, but with good medicine and good treatment, I've been doing really well. I ran 4 years of Division I track and cross country down the road at American University. And so I'm doing really well. And so my mission is really just to educate others on the importance of taking your heart health seriously.
My goodness, what a hard pill to swallow, though, especially for a young woman and family. How atypical or typical is this?
This is very atypical, and I think the reason it took so long to diagnose Jude is because she had normal arteries for all intents and purposes. And her underlying condition was provocable by different stressors, but sometimes we don't even know what can provoke it. And I think they finally picked it up on one of your visits, and they came up with a diagnosis of coronary vasospasm and put her on the appropriate treatments, and that's why she's able to continue to exercise, compete, and picture of happy health.
So the message is advocating. The message also is that, of course, heart disease is the #1 killer of women in the United States. So what do you want our viewers to know about it, Doctor?
Advocate for your heart health. As was pointed out, yes, it's the #1 killer. I think we're very good about checking for and screening for breast cancer. Breast cancer kills about maybe 42,000 women in America each year. Heart disease kills almost 250,000, so 250,000. So being aware and doing the breast screening, yes, but heart screenings are just as important.
Jude, we saw a public service announcement, if you will, of you really talking about like a tough issue about CPR when it comes to women of color or people of color. So what is the bigger message now? Because again, your case, a bit atypical, but for some people who are in need of CPR, what's the path that often they find themselves on?
Well, through my work as Miss District of Columbia this year, I learned that DC has one of the worst rates of bystander CPR in the entire country. And women, Black and Hispanic adults, are less likely to receive CPR from a bystander than any other groups. And that scared me, because in my case, I didn't need CPR. I didn't lose consciousness, my heart was still beating. But for the majority of people under the age of 25, sudden cardiac arrest, what happened to Damar Hamlin and Bronny James, is the #1 killer of people under the age of 25. And so it's my mission to find a tangible way to enact good, and CPR education and AED education is the way to do that, because it's a tangible way that we can all step in and save a life. And so that's why, with my partnership with MedStar Health, we've been making CPR and AED education more accessible, because the goal is to change that statistic here in DC.
Okay. Our time is so fleeting. How can people get more information through MedStar?
Well, one through your regular doctor, but then through our website, we have MedStar Health.
All right.
Thank you. And please check out MedStar Health/CPR.
I love that. Thank you both for coming in. Best of luck to you, and thank you so much, Doctor, for joining us.
Thank you.